Good afternoon, everyone, and welcome to the monthly HIIN update. I'm joined here at the Indiana Hospital Association with colleagues from our patient and safety and quality team. So we're here in Indianapolis. We're ready for some sunshine. So I'm going to walk through just some updates today and have some announcements to make. We will review some data updates and deadlines as well. Touch base on our patient and family and health equity, and then look at some upcoming events as well. So as we get started, just wanted to start like we do with all of our meetings with our mission. And our mission is to engage and inspire healthcare providers and to create that safe cultures, create reliable systems of care, and prevent patient harm in Indiana. And we do that, as we all know, under the key principle that we don't compete on patient safety. So if you'll recall that this picture here is drawing a state of mind was something that Regina Holliday actually drew during the Patient Safety Summit last year in June of 2018. So with that, I just want to make the announcement. I think we've been putting it out on some of our Save the Dates. I just want to make sure everyone has it on your calendar. And on Tuesday, June 4th, we will be hosting the 2019 Indiana Patient Safety Summit. We are actually going to be hosting this event at the Embassy Suites in Plainfield, Indiana. So that's right off of I-70, so easy access in and out of I-70 for that event. So look for the agenda and the registration link. It will be coming out very soon. So I'm going to be focusing our day on storytelling, and we're really excited about the day and the speakers that we have joining us on June 4th. As we've been doing for the last several years, we have been showcasing and awarding our Patient Safety Awards. So there are these 2 awards, and those applications are now available. The first one being the Patient Safety Award for Service and Excellence, Service and Leadership, and that really looks at someone who's gone above and beyond to improve safety with his or her organization. And that really, when we say organization, that could be the person's hospital, person's system level. It could even be a regional patient safety coalition. We can certainly leave that up to you on how you want to define that. We've tried to keep these nominations short, so there's not a lot of details that you have to provide. And then also the second award is the Patient Safety Award for Innovation. And this recognizes an individual, group, or program that's developed innovative ways to improve or encourage patient safety within their organization. And again, that could be at the hospital level. Again, it could be just an individual, or even it could be a regional patient safety coalition. So that award nomination is also due on April 8th. If you have any questions, you can contact Casey Hutchins, and her email address is listed here on the slide. I really would encourage everyone to take the time, to think about who you might want to nominate. We will be recognizing everyone that's nominated at the Patient Safety Summit. We're going to be putting together a compendium that will showcase everyone's work. So there's a lot of great things going on in the state, and I can't imagine that we couldn't possibly have one nomination per hospital. That would just be phenomenal if we could really see those nominations, because I guarantee you that there's someone to recognize, whether it be a leader or a project that's being done at your organization that deserves recognition. So before we get into this next slide, I just wanted to kind of tee it up. We have been getting questions about what's going to happen at the end of this month with the HIIN, and if CMS will be exercising what we refer to as that option year for the HIIN. And at this time, let's be upfront with you, we have not heard yay or nay So we don't have the red light or the green light to move forward. So as soon as we have that information, we will certainly be passing that along to everyone. I would say that our team is very hopeful, and HRET is very hopeful that this work is going to continue, but we have not gotten any official notification. So with that, I just want to spend just a minute just kind of celebrating some of the progress that we've been making at the statewide level with our HIIN work. So there has been 3 areas where we have exceeded the 20% reduction, and that is within the adverse drug events with the anticoagulant safety measure. And then looking at CAUTI and CLABSI within the ICU level, we have exceeded the 20% reduction as well. And I actually said 3 measures, but there's actually a 4th one, which within worker safety, the patient handling, we have exceeded the 20% reduction. So I think that's a great opportunity for our state collectively to pause and to celebrate some great work. I guess, especially in the area of the CAUTI and CLABSI and the ICU, that's an area where we've been focusing on for quite some time. To see that reduction is really fabulous. There are several measures where we are so close, and when I say so close, we are like at 18% reduction and 19% reduction. The first one being CAUTI all settings. We are very, very close, meeting that 20% reduction, as well as the pressure ulcer stage 3 measure. And then we are so close with falls with injury, and this is an area that I'd love for us to meet a reduction at 20% on each one of these, but falls with injury is one that I've said we have been flat as a state since I know that I've been here at IHA since 2012. So to see this reduction finally happening, it is just terrific, and it's definitely something we need to pause and to celebrate. There are areas where we need to continue on as a state. For instance, in the SSI, surgical site infection related to like colons and the abdominal hysterectomies, knees and hips are some areas where we need to continue to focus. But there's great things that we've had in place, some webinars that Patrick and Annette have been putting together to focus on these areas. So I think we're going to see that turn around, as well as the VAE. We had a VAE webinar series, and I just don't think there's been enough time for us as a state to see those results coming in. So again, kudos to everyone on the great work. As I said, we don't know for sure where CMS is going to fall with the HIIN extension. We are moving ahead, anticipating that it is going to be a green light. So within the next few weeks, we actually have some new things we want to present to you that are for our HIIN participants. And the first one is this antimicrobial stewardship certification. And I'm going to turn over to Annette for just a moment to talk about some scholarship opportunities.
Thanks, Karen. I do just want to let you know that I did receive one note from someone who's having some difficulty seeing the slides, so I've asked our moderators to help. So help is on the way. And as Karen mentioned, we're really excited about some things that are coming down the pike in over just the next few weeks. So one of these is an opportunity to really advance your team's work in the antimicrobial stewardship realm. And this is something that we just kind of finalized within the last 24 hours. So we're really excited about that. We're going to offer, and it will be kind of at a first-come, first-served basis, 25 scholarships to be awarded so that someone, one person per 10 participating hospital can go through the MAD-ID program and obtain a certification with regard to basic antimicrobial stewardship. So what this involves is some online learning as well as doing some practical application of the skill sets that you'll be learning through the modules And so we're really excited about that opportunity. So there's going to be a very quick turnaround. You'll have some of these hyperlinks within the slide deck that Casey will be sharing, but wanted to let you know that we'll also be sending to the HIIN key contacts, and we do have a listing of the Regional Patient Safety Coalition antimicrobial stewardship leaders to share amongst their HIIN hospitals. And so we'll take care of taking a look at those applications. So please do share this in your organizations and select one person to be considered for this. And hopefully it'll be so well received that as we continue this work in the future, this might be an opportunity for us to open this up to more folks. Oops. Sorry about that.
Okay. And this is Madeline. Good afternoon, everybody. Just wanted to share with you, you guys probably have received some information on this. Just to reiterate, we had the pressure injury training by the Wound Care Education Center back in January, and we had a wonderful turnout and some really, really good feedback. And because of that, we were able to secure the funding from HRET to provide a second educational training. We have asked that the responses to this be sent to us or registered by March 11th. We have added an additional group, and that is our Small Rural Hospital Improvement Program Care Transitions Project members. And so I know that I've gotten a couple questions about this already. If you are a HIIN and a SHIP, can you have two people? Just reach out to me for any questions that you have. The conference is on March 19th, and as I said, it's a repeat of the one that we had back in January. So make sure that you get this in the hands of your folks who are responsible for pressure injury education, and get them signed up. We look forward to having another full room for this. And next. Another great opportunity that we have coming up in June, from the 12th through the 14th in San Antonio, Texas, is the annual team training conference. Last year it was in San Diego. I was able to attend, and it was wonderful. We had some scholarships that were supplied to us, and we were able to take some of our HIIN hospitals. And once again, AHA is offering 100 scholarships to HRET HIIN hospitals to register for the conference for free. This is just a little bit different. It's from the main conference registration. It doesn't include optional pre-conference sessions, but there is a link on here that you can apply for one of the scholarships. So please do that. I will tell you, if you are a team training, a team steps hospital, or interested in learning more about it, this is a great place to learn about it.
Before you go on, there is a question in the chat, Madeline, that you can answer. If we send a nurse to the first pressure injury seminar, are we allowed to send a different nurse to this pressure injury seminar? Thank you, Lori.
Absolutely, Lori. That is a great question, and that is why we opened it up, because we had so many more people from hospitals that wanted to be trained. So, yes, please, bring them on. We got lots of chairs to keep warm. And y'all know what next week is. I hope you're all teeing up for this Patient Safety Awareness Week, March 10th through 16th. IHA has done a little bit different. The Patient Safety Center has done a little bit different programming, as you guys have seen in the information that we have sent out. And we're kind of leaving it with you to choose your topics for the day. So we've given you a wonderful library of different topics, but we will have our own little push out on these days, and you can see here for 6 of the categories, or no, 7 of the categories that we've given you anyway. But Monday is going to start our big bang off on our work week, and that will be the Speak Up for Safety. So Sunday is the official kickoff, but we thought it would be great to start the week off for Speaking Up for Safety. So as I said, Casey sent out the Patient Safety Awareness Toolkit back about a month ago now. And so if you haven't seen that yet, or your people who would be responsible, like your marketing people and such, they also received some information on this. But just make a connection with them so that you have these tools up and loaded and ready to go to celebrate Patient Safety Awareness Week. And don't forget, last year, pretty much everybody got the Patient Safety Awareness Week pop-up banner. Don't forget to pull that out of the closet, dust it off, and pop it up in your places to celebrate your work week. And with that being said, we do have a couple people that we would like to talk about some of their best practices that they have done for the Patient Safety Awareness Week, and some cool things they'll be doing this year, so we could share this information with you. Do we have Julie Glover on the phone?
Ms. Glover, I've opened your line.
I am on the phone.
Hey, Julie Glover, tell us about your wonderful program last year and what you're doing this year.
Well, thanks. We have a really engaged group of folks who are all about having some fun with this topic. So we have a 3-hospital system, and each of the hospitals is doing basically the same thing but on a different scale. We've also been very blessed to have a generous contribution for some prizes from our medical staff, our healthcare quality department, and nursing administration. We're doing 2 things. We first ask all the departments to create a poster about what they do for patient safety. We're trying to not make it terribly cumbersome for them. So just a 1-page PowerPoint or Word document, and then we'll print those. We have a big alcove outside of our cafeteria, and we display all of the posters. Everyone who comes by is invited to vote for their favorite poster from that grouping. And then at the end of the week, the department that wins for the best poster will get a department party to celebrate, and everybody who nominates or votes on one of the posters is in a drawing for prizes as well. The other thing we're doing is it's called the Little Shop of Patient and Staff Safety Horrors. It's an interactive sim set up in a conference room near our cafeteria, and staff will go through, and we're setting up 4 different stations, but it's an interactive sim that we really want to target all departments in the hospital. And then we ask folks to come up with a summary of what patient safety things they saw, what were they concerned about, and fill it out on an entry form. And then once again, we do have some small prizes for folks to win who participated in the little shop. So that's our strategy here.
That is wonderful, Julie. I think I'm going to try to sneak in there and see what you guys are doing over there, and maybe take some pictures. Annette, did you have somebody? Oh, I'm sorry, Julie. Go ahead.
I was surprised last year how many folks enjoyed looking at the posters. We had over 400 people vote on posters, so a lot of those were staff, even visitors and stuff. And so last year after we kind of got it up and rolling. This time people have cranked it up a little bit, so I think the posters will be even more informative and also fun. So we're looking forward to it. So thank you for asking what we're doing.
Thanks, Julie.
And I wonder, Jen and Jim, if you could unmute Lisa LaCrone's line. Lisa's going to share what she and some of her sister organizations in Northwest Indiana are doing.
Ms. LaCrone, your line is open. Please go ahead.
Oh, okay, thank you. So one of the things that we're trying to really promote as a system has been our Good Catch program. And we're going to do a baseball-themed Good Catch in recognition of an event that could have resulted in harm but was able to be prevented. So what, is referred to as a near miss or a close call. So we're really trying to promote and encourage a culture of safety by empowering staff to promote good catches, and this is something that we also are incorporating into our daily leadership huddles. And the other thing that we're doing is we're trying to also reach out to the community, and we'll be doing some things in our cafeteria to promote patients as partners in our care team, and to let them know that, that they definitely are part of that care team. We're also promoting that with the Ask Me 3 poster, in addition to some of the Get Up, Wake Up, Soap Up. We're going to promote the Up campaign and the Speak Up with that as well.
Thanks, Lisa. And I would just add on that when Kula was sharing on Friday what you and your sister hospitals are doing, I think the Great Catch theme, and here it is spring training time, that y'all are going to be in baseball jerseys and handing out Cracker Jacks and making it fun, just like Julie was sharing that they're doing. So I think these are two beautiful examples of how you can really tackle something that can certainly be tough at times, but in a very fun way to engage folks.
Yep.
Thank
you.
And this is Casey. I'd like to tack on to that. I'm getting all these great mental pictures from what you're describing. And so please remember to take lots of pictures of the things going on during Patient Safety Awareness Week. And please send those to me in an email, or I'm following most of you. If you post the pictures or even videos on Facebook, we'd love to see all of those and to share all your great ideas with everyone as well.
And certainly during this call, we will open up the lines at the end. But in the meantime, if you have you want to chat in some of the things that you're planning to do at your hospital in the chat box, we would love to see those. And I'm sure that everyone on the call would love to see your ideas as well.
Data update, that's me. Thank you, Annette. Last week, the 6.5 version for the Intent Improvement Calculator was made available. The dashboards have extended to include 2019 data. The data ranges to resolve large state issues with discharges. So there was a couple of bugs in there when there was too many months of data. They fixed that. And then the rates on CEO dashboard and dashboard tabs have been updated to include measure-specific multipliers. So some of the timelines just to keep in mind. So on March 7th, so that is on Thursday, the NHSN data will be pulled into CDS by HRIT, so you can go in there and view all of those. All the data, all the manual harms data due into CDS is due through January by March 14th. So this is the submission of December and January, and for readmissions, that will be November and December. And then NHSN will also be, that data will be pulled into CDS again on March 21st. Same thing with the March 14th deadline is the operational metrics. This includes the PFD, so the person and family engagement, and then the equity sheets. Your HIIN primary key contact has sent you the documents with your previous answers, so if you would please fill that out and then return it back to your HIIN key contact. This is just the example of the type of documents that you've received. So on the left will be the first answers that you provided to us in November, and then the middle will be January, and then all the way on the right will be the March responses that we're asking for. Again, this is just a PFE guide just to look through, and it will explain the 5 questions. And health equity guide, again, this is 7 categories that we are asking you to fill out with the basic, intermediate, and advanced. It'll also have the links on the side of your reporting document to go into this health equity guide electronically. And again, this is there's some tutorials available online if you just want to go through. All these hyperlinks are available made to you. There's a 15-minute tutorial explaining why and what of the health equity metrics, and then just some how to answer, how to improve some of those responses are all within these links.
Okay. All right. Just wanted to share with you a few upcoming events. We're really excited because the Coddy Fish Bowl is just about, those fish are about to bust out of the bowl. We're going to be finishing up with the last event next week. Gosh, it's hard to believe March 12th is next week, but that's Eastern time, so for those of you centrally, please roll back an hour. What's very exciting is that we've had the Franciscan Health Crown Point team participate, and they've had a lot of insights and learning. So I would encourage you to register using this link, or certainly you can go to the hret-hin.org website under events and register at that time. But as Karen said, we've done some great movement here in Indiana with CODIs and CLAPSIs in the ICU, and then certainly we're very close with all track units. So there might be a little nugget of information that could advance your team to where you want to be. Next, Patrick and I have been doing some really fun work with Barb DeBond, and on February the 12th, we co-hosted with her the first of 2 installments of surgical safety and SSI prevention. And what we heard very loudly and clearly from our hospital partners is that colorectal surgeries were really kind of a sticky wicket for you. So we focused a lot on that February 12th installment on those types of surgeries. And so you have lots of resources, including a recording link and the associated slide deck that are available to you. And I believe that Casey included that with your HIIN alert that was sent prior to today's call. So to follow up with that, we're joining with Barb again on March the 12th. That's a very popular date. And we're going to be continuing our conversation with regard to just some global surgical site infection prevention measures that, maybe it might just be a little different way to look at your interventions that you're currently doing. So to join that, you don't have to register, but here is the link as well as the dial-in number. And just as with the first installment, I would just remind you that it will be recorded, and we will certainly have that available. But please do, if you don't believe that you are the person who this is best suited for, please forward that on. We already have a large number of RSVPs to our Outlook calendar invite, and you certainly are welcome to forward that on to your teammates. Patrick, do you have anything else to add?
No, cover everything.
Okay, so we're really fired up because this has been very exciting for us, and we would like to hear from you. If your surgical teams are doing some great work or innovative or different approaches, or you had an aha moment, we would love to hear from you. So moving forward then, in complement to those two installments, those educational events, HRAT and Barb Devon, our good friend and honorary Hoosier Barb, she actually moderates 3 podcasts, and I listened to these last week, and they're really pretty awesome. They last, I think the shortest one is like 15 minutes, and the longest one is maybe 25, 28 minutes. And so, again, please do share these, short learnings. The first 2 were really focused a lot on not just surgical safety globally, but they focused a lot on orthopedic procedures. So if that's an area that you think, there might be some learnings there. And then the last is really how are we engaging our patients and families. But I really do suggest that you utilize these, and this might be a really great way to start a staff meeting for your surgical services. So think creatively how you might be able to use these tools and resources.
Hi, everybody. It's Casey again. We've got some great upcoming webinars through March from HRET, including starting on March 6th, which is tomorrow, right? The post-op sepsis SNAP, the final summary webinar. Got the number 4 Coddy fishbowl, PFE, antibiotic stewardship, several of these coming up. These are also all listed in the HIIN alert that you received prior to this webinar with the registration links attached. So that's a great place to go, one stop where you can find all of those and click directly to the registration link.
Okay. Before we open up the lines, there is a question from Lisa McDonald. She wants to know, when will we send out the slides?
I should get these sometime tomorrow, hopefully, and I hope to send them out before the end of the day tomorrow.
With the recording?
With the recording,
awesome.
Yeah.
Great question, Lisa. Thank you.
Well, if we could open up the line for any questions, or again, if you want to share what you're planning to do for Patient Safety Awareness Week, we would love to hear your details.
And ladies and gentlemen, the floor is now open for your questions. If you would like to ask a question or have a comment about today's meeting, please press star and 1 on your telephone keypad. We'll take questions in the order that you signal it. So if you find that your question has been asked and answered, you may remove yourself from the queue simply by pressing the digit 1. Again, that is star and 1 on your telephone keypad if you prefer to ask a question over the phones. We'll take just a moment to allow everyone a chance to signal. And once again, ladies and gentlemen, that is star and 1 on your telephone keypads if you do have anything to share or have a question about today's webinar. We'll pause for just a few more moments. And we have no signals from the phones.
Okay. Yeah, can I call out somebody? Sorry, Phyllis, but you know I love you. I was just curious. I loved what you were saying about putting some information up in your cafeteria and in your public areas for not only the staff, but I wonder if you could just speak really quickly to what you're doing to help folks maybe from the public look at their home environment.
And Ms. Denford, your line is open. You may have us on mute.
Okay. Phyllis's audio isn't coming through, but Phyllis, you're welcome to chat in, but I'll kind of summarize what you were sharing with
I'm on.
Okay.
I got interrupted. Someone interrupted me, and I had to give them my attention for a couple minutes. So what we're doing as far as the Patient Safety Week for bringing the home environment to their attention, is that what you were talking about? Okay.
Yeah.
Oh, as we have our setup in the cafeteria where we hand out, things for the staff, and then also safety items for the public, such as we have coloring books for kids about keeping safe, and we have information about falls and medication safety for, the public. But we're also going to have like these posters, which is an interactive thing, some for staff and some geared towards patients in their homes, especially the patients who are receiving like home health care or just other general kind of, safety things in their homes. As we move towards more of a telemedicine type of world, we thought maybe it would be a good idea to start bringing these things to people's attention as they participate in that kind of care.
Thanks, Phyllis. I think it's really good, for people just to have that situational awareness of, all those fro rugs and things that could be a trip hazard in our own homes that we might not think are a safety issue. So I appreciate your team, including that in your effort.
Again, thank you, everyone. And I think one more final comment about Patient Safety Awareness Week is, as you're posting to Facebook and other social media, again, let us know what you're doing with pictures, but then also, make sure you're connecting with your communications and marketing teams. I think it's a great opportunity as you're doing some of these events to invite the news media in, to actually capture this training that you're doing with your staff. I think it's a great opportunity. Oh, and then also, just leave you with that we actually here at the association will be doing some activities with our staff as well. So we'll be sure to share those pictures with you too. So with that, I think we'll go ahead and end the call. Thanks, everyone, and have a great rest of your week.